You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, smile makeovers, extreme smile makeovers. According to my first guest, if you don't like your smile, you can do something about it in a very affordable way. With us we have cosmetic dentist. She is Tennessee's cosmetic dentist, go-to, Dr. Danielle Davis. Dr. Davis, welcome to the program.
Thank you for having me.
Now, I know you brought a stack of photos, but before we go to those, before we get into today's topic of, veneers and crowns and what you can do, who's the typical patient you see?
So we see anybody from young, old, all walks of life. Sometimes we have people who come in who just want to do whitening. They are doing something over the counter and it's just not doing it for them, so they want something a little bit stronger. A wider smile is going to make you look a lot younger, more approachable. We do crowns, root canals, bridges.
So you do
children.
root canals?
Yes.
Because typically they would go to an endodontist or something.
Yes.
So you've had what, training? Extra training?
Yes, we try to keep everything in-house so it's a little bit easier. We don't want to shuffle you around a bunch of different practitioners all around the city. It's so much easier when you know the friendly faces you're coming to see and you only have to go to one place.
Okay. Now, people don't like going to the dentist. Do you
So
hear
I've
that
heard.
all the time? When do
Every
they say,
day.
hey, no offense? Do they really, how do they say it?
No offense, and none taken. But we try to make it as
They say
pleasant
no
as possible.
offense, but I don't like the dentist.
Yes.
Do you have a funny one-liner to come back after all this time?
It's something we've always heard, and you just kind of giggle and move on. We try to make it as pleasant as possible. We have TVs on the ceiling. Try to make it so that it's as enjoyable an experience as we can.
So, okay, we talked about whitening, you do crown and bridge. Now let's talk about, a little bit of the cosmetic stuff. What are you doing? Like, what if you had to say there were categories of cosmetic dentistry, what are they?
You've got, you can do anything that's really simple, like whitening, closing small gaps, full crown and bridge work. We can mix implants with that, Invisalign to help straighten out your smile. There's everything from, minimally invasive to full mouth reconstruction.
Okay, we were in the green room and you were saying, it seems like in Tennessee, where you are, there's a lot of people with gaps in their front teeth. And some of them love them and some of them hate them, but the ones that hate them oftentimes don't do anything about it.
Yeah.
So you fix a lot of those. That's
Absolutely.
like a big thing.
Yeah, and it can be, like I said, it can be something where we just add a little bit of, composite bonding and just takes about 15 minutes. You can do a couple of crowns, help close in those spaces, or if you wanted to do something a little bit longer term, you've noticed that your teeth have shifted as you've gotten older, we can do Invisalign in as little as 6 months, absolutely no cutting down of your teeth, and then you've got perfectly straight teeth, easier to clean. So we had one younger girl come in with her mom, and she just didn't like the small space in between her two front teeth. You and I might look at it and we wouldn't think twice about it, but it kept her from smiling. So we fixed that, added a little bit of bonding, took a couple of minutes, and the next time she came in with her mom, completely different girl. So outgoing. Her mom said she was so much less reserved in her social interactions. It just completely changed her. Something that took a couple of minutes, but to her, it was everything.
It was a big deal. Now, I told you, we have an employee with the Wellness Hour, and she had a gap in her front teeth. And she said she hasn't smiled, and she's 30 years old, hadn't smiled since she was 8th grade, Erica. And in one afternoon, gets it fixed. Is that the way? I mean, a lot of people just put it off. Is it the fear of the dentist, or
it can be a combination of
they
things.
just don't know their options?
Fear of the dentist, they don't know their options, they're scared it's going to hurt, they're scared it's going to be too expensive. There's a lot of things holding people back, but if you don't like your smile, you can absolutely fix it.
Now you say, for some of these people, like it almost changes their life. Sounds a bit like an overstatement.
It's like anything else in this world. If you change it, if you change something they don't like, they can start seeing themselves as they want others to see them. They get a confidence that you never knew that they had. It can help them in social interactions, business transactions, everything. Just completely changes.
Now, you brought some photos. What are we looking at?
So this is one patient that you might think that it's something that you wouldn't see every day.
That's got to be unusual, teeth like that, because they look pretty bad.
It's not. People like that just tend to hide their teeth, so you don't see it. This patient had some medications when he was younger that caused an intrinsic staining of his teeth, and then he also had a habit of sucking on lemons, which just completely eroded a lot of his enamel from the acid in the lemons. So he was getting a divorce. He'd always spent his whole life taking care of his kids and his wife, and he wanted to do something for himself. So funny story, this guy actually came in and he wanted dentures, plastic teeth, because he was so unhappy with his smile.
Like he just wanted you to pull all of his teeth out and give him dentures.
Yep. And what people don't realize is that, dentures aren't a replacement for teeth, they're a replacement for no teeth. They're better options, much better options. He wasn't a great candidate for whitening because that he had so much wear on his teeth. He wanted them to look more youthful. So he had a couple of options. We looked at doing veneers. We could have done some whitening just to brighten the smile, but he wanted more. He wanted them to look more youthful. He wanted that wear to be away. So we ended up doing full coverage crown and bridges because he did have so much erosion and his teeth were so thin from all that acid. We strengthened everything. He had great bone, he had great structure. He had a lot for us to work with. And so when we did all of this, it just completely changed him. He got a new girlfriend. He started talking about how, his customers, he owned a small business, and everybody always talked about how friendly he was, but they kept saying, something's different about you. And he said, it must be, I got a great haircut. But when he told me, he was like, I never smiled before, and now I can't stop smiling. Now take a look at this before and after, side by side.
Okay.
You'll see a completely different person, somebody who is proud of their smile, somebody versus who's going on a job interview and, they're ashamed and trying to hold back and always just kind of look like they're reserved or maybe not even friendly, but they're just embarrassed of their teeth.
Now, he also looks more handsome.
Absolutely.
I don't think anybody would disagree with that.
Younger as well. About 20 years younger when he walked in the office the next time.
Is that right? And you say they even act like their personality changes.
Yeah.
They're like just back to where they used to be? Like back of more of who they are, or what's your take on it?
I think just letting their true personality shine. I think most people are naturally pretty happy. They just sometimes don't, they're embarrassed or ashamed, and so they just kind of hold back because they, when we're not smiling, we don't look very friendly.
Now, a lot of these people, because they stayed away from the dentist, they're afraid of the dentist, but you're big on sedation.
Yeah.
So tell me what you're doing.
We can offer, laughing gas. You told me yourself, you don't mind the dentist at all, but when you go get your cleaning, it makes it so much more enjoyable.
It is true. The nitrous, right?
Yes.
You put the little, and I told you, it's like, I have no fear of the dentist, but when I do that, it's like I'm bummed out when the cleaning's over because you feel so doggone good. And then you come out of it immediately. You can drive yourself home.
Yep.
So nitrous so you say you do nitrous on just about everybody.
Yeah.
You guys call it laughing gas.
Absolutely. We always numb the teeth so you don't feel it in that respect, but it just makes it a little bit more comfortable, a little more enjoyable experience.
Yeah, I mean, if you find a dentist that does this, I always feel like, and I want your take on this, that some people say, oh, well, all I have to do is numb them up. I think that's insensitive, of the dentist, because it's so much nicer when you could just relax, right?
It's definitely, it makes it a lot more of a enjoyable experience. You can kind of remove yourself from the situation because, like you said, it may not be your favorite place to be, but we can make it as enjoyable as possible. Now for the bigger, more complex things, we can give you a little pill, a little bit of medication right before your appointment. Just helps you relax you even more, and then you just get driven home by a significant other, loved one, and they take care of you.
Now, I think you're the one that told me this, or maybe it was your husband when I interviewed on the program, but some people get a pill the night before that you prescribe.
Yeah, we can do one the night before and then
Why?
one the morning of. It just helps relax you a little bit more. When we're doing these big cases, sometimes you're a little bit nervous, so we can help kind of put your mind at ease, make it as easy as possible.
So would you say like 80% of the people that you're doing, a multiple things, they're either having the laughing gas or some sort of a pill?
Absolutely, because it's so easy and it just makes it that much easier on you.
But not every dentist offers this, is that correct?
No.
Why? Do you have to have special licensing or?
You do some extra continuing education just to make sure so we know how to manage it, but it's nothing complicated and it's minimally invasive.
Okay, good. I know you didn't want to go negative about any other dentist, but it's really the only way to go, in your opinion. Okay, good. You have other photos?
Yes. So this young man here, he was getting married and he got hit in the face with a baseball bat.
Oh.
So you'll see he's got that big gap in between his two front teeth. There's a couple of different things that we can do. Most people, if it's just a quick fix, they would do like what we call a flipper, which is just a little removable retainer that has a tooth attached. They're terrible. Nobody likes that. Right. They get food caught underneath them. They come out. They change the way you talk. Sometimes they have ugly metal clasps around it to hold it in place. The other thing that a lot of people would do is just do a bridge, but he's young. We don't want to cut down those two teeth next door and then they're all attached together. So if something happens to one of those teeth when he gets older, the whole bridge is bad.
Okay.
So what we did a combination of dental implants and crowns because as we got to talking a little bit more, he just mentioned, I've always been really self-conscious about the way that my teeth look. They seem like they're kind of going every which way. So with him, we did a single dental implant, replaced that missing tooth, and then we did 5 crowns next door. So he actually didn't end up telling his fiance that he was doing all of those front teeth. She just thought he was getting that front gap filled. And she came in and the tears started flowing. I mean, she couldn't believe it.
She got choked up just looking at him?
He was a completely different person. I mean, look at this before and after. Can you imagine the difference it would make if you walked in with one smile and walked out with the other?
Yeah, yeah.
Completely different, life-changing.
Like when they see it in the mirror for the first time, what's that like?
It's the best feeling in the world. For me and for them, truly.
Okay.
And there's more to the story. You know, they ended up getting married, and I got a picture on the back of it, and it said, "These smiles are thanks to you," and beaming from ear to ear. And I was just so happy I was a part of their big day.
Do people tend to do cosmetic dentistry for occasions? Like getting a divorce, getting married, daughters getting married?
It can be. You know, life events can trigger people just to take action. You know, I've had patients where they've always hated those gaps in between their teeth, and then they got into a car accident, and so one of them, the teeth fractured, and that was what caused them to take action and actually fix the smile that they had kind of disliked for a while, but this gave them a reason to really do it.
So we'll have another photo. Oh, wow. Like, what's going on there when I see this? And when you look at this, like it's a patient, do you get excited about it? Do you think, boy, this is going to be good?
I do. It's a young guy, and he, in the South, we love our sweet tea, but with that is a lot of sugar, and so it can kind of break down your teeth. And he can brush and floss his teeth all day long, but he had a gum infection, a bacterial infection that he just couldn't get ahead of. And then what brought him in was that gap in between his 2 front teeth when it started to make that hole there.
Okay.
And he was like, but it was way bigger than what he realized. You know, those teeth were super broken down. It's kind of like an egg, a hard outer shell, and the inside is just mush.
Okay.
And so we cleaned everything up and gave him his smile back, and it changed.
Wow.
It changed how he saw himself. It changed how people around him saw him. He's more confident at work. And it's just great to see him in the office because he comes in and he's so much more happy. He's got a kind of a little pep in his step, and it's great to see. So Men's Health did a survey, and they said that smile was the #1 thing that people looked for in a spouse.
Okay.
And then you've got people who come to job interviews and things like that. You know, if you've got a confident smile, you're going to be worlds ahead somebody who might look a little bit more reserved and shy. Think if you had a set of twins,
okay,
one who loved their smile and one who, you know, didn't like that little gap that she had in the front. Both went to the job interview, both had the same qualifications. Who do you think is going to get the job? The one who's more outgoing and gregarious, or the one who is kind of shy and doesn't really smile and covers her mouth?
So it's not necessarily you hire the one with a prettier smile, but if one is smiling and talking and one isn't, it's an obvious choice. You hire the one that has more charisma, that's more positive.
It's a smile it's the personality that shines through when you're happy with how you look and you feel confident. It can ignite romance. It can get you a better job, you know, when you feel more confident.
Better job?
If you're more confident, of course.
Okay.
If you are more outgoing, if you can talk to people, if you're not so busy trying to hide behind, you know, insecurities.
Can you spot that, by the way, as a dentist? Like, let's say you and your husband, who's a dentist, you're out and about. Could you tell when people are hiding their smile or ashamed of their smile?
Yeah, it's the people who kind of smile behind pursed lips, you know. They cover their mouth. They might, you know, smile and put their hand over their mouth, something like that. It's just little things that they do, and they don't even probably necessarily realize they do them anymore because they're so used to it.
So used to it. Now, so when you fix their teeth, give them a smile makeover, does it take them a while because they're so used to covering their smile?
Of course. Sometimes it almost looks like they're kind of grimacing when they start to smile because they're so not used to it. They just they don't know how to do this big smile. You know, you and I are pretty happy with our teeth. We don't have any of those insecurities, so it's hard to imagine. But if you can think about, you know, the person who always sees in photos that they're, you know, trying to figure out ways to strategically hide their teeth or smile, you know, look happy without showing them. It's kind of exhausting. You know, we live in an age where we take photos all the time. There's always selfies. You're always posting stuff on Instagram and Facebook. And if you're not happy with how you look, you know, it's hard because you're always
kind of holds you back a little bit.
Yeah.
You know, we talked about this too, that a smile makes you more attractive.
Oh, yes, absolutely. Even if you're, you know, you don't have that perfect Hollywood smile, but you like your smile, that is conveyed.
Okay.
In what you're doing.
The confidence makes a big difference. Now, what about on the opposite? Because you've said this to me, that people with bad teeth are judged. Elaborate.
As much as you don't want to admit it, you know, people think that, you know, you're unclean, you don't brush your teeth. You know, the villains in movies, they always have bad teeth. You know, the poor people. And when you're trying to find somebody who looks homeless, you're not going to find somebody who's got bright white teeth. You're going to find somebody who's got missing teeth or, you know, crooked teeth, things like that.
You know, in the movies, you know, in Hollywood, of course, we're in California where I'm interviewing here today, but there's dentists out there that make fake bad teeth for movies when they're trying to cast somebody that's homeless or poor. So I think our brains kind of associate bad teeth with poverty, uncleanliness, and you say that's just not the case.
No, absolutely not. Sometimes it's just, you know, you've genetically got bad teeth, or you've got a bacterial infection that you could never keep ahead of. You can brush your teeth all day long, but it's never going to change the, you know, the dark spots that are on them. That's where we come in and we can fix them in the day.
Some people are really like embarrassed to even show you their teeth, and you're the dentist.
I hear all the time, this is probably the worst you've ever seen. It's never the worst I've ever seen. It's exciting when we can see stuff like that, because there's so many different options that they can have to fix them.
Now you call it, your term is full mouth reconstruction. That means people with really bad teeth and gums, no matter how bad, you kind of rebuild it and give them a good smile.
Absolutely.
Common?
There's nothing, I can't name a single case where we couldn't do something to help a person. You know, a smile can really transform your entire appearance. I brought some photos of some of my husband's patients that are some of these dramatic transformations. Okay. And you can see these people who, you know, before you might have judged that they were, you know, a little bit less educated, or maybe that they were reserved, because these people, they're not smiling with their teeth. They're not going to show you these smiles. But it changed everything about them. How they interact with people to get jobs, how they interact with potential partners, with their friends, how they interact in social situations. So, I mean, look at his face. Would you say that he looks younger?
Yeah.
More attractive?
Yeah.
Happier?
Yes.
I mean, this isn't even my patient, but you can see just from a single photo, it completely changed his entire demeanor.
Because, you know, respectfully, you know, and I told you this, I feel like it's just teeth, but it's more than that. You know, when you look at these photos, you see, and I'm not trying to side with you on this, but I think it's pretty obvious that this is changed. So this next photo, what are we looking at here? Again, this is not your patient, but big difference.
I mean, you can look at this, it drives home the point. You know, this patient had a lot of medications that were just kind of broke down his teeth, and you can see in the after, he's not used to smiling. This is right after he got these teeth, and it's like he doesn't know what to do with them.
So I'll get about 20 compliments, and then next thing you know, he's on Facebook with selfies, or Instagram on selfies. Then he gets defriended.
Yep. Comes a little bit obnoxious, but it's amazing to see how it completely altered his appearance. He's not the same person.
I know your husband in his practice does a lot of dental implants, and he always says no more dentures. But you say, even as a cosmetic dentist, that people come in and they think they need dentures, and you could save a bunch of teeth and rebuild their smile.
A lot of times it's just, you know, a couple of crowns or a bridge. There's a lot of minimally invasive things that we can do that can completely change what you appear to be a hopeless case, or something that's the worst that we've ever seen.
Okay. Now, this last one, this is another one. She looks so happy. Again, this is one of your husband's patients, but again, bad before.
I mean, now she can really smile with that big open smile. You can see that she's a really joyful person, and now her face and her appearance can show that through.
Now, let's move on to veneers for a moment. Okay, so if somebody comes in, whether it's crowns or partial crowns, or in fact, you call it, you say for some savings, you do a special kind of a crown.
We can do, sometimes with veneers, you know, people always worry that they're going to pop off. And so if you don't have a perfect bite, that can happen because you've got that too many forces coming on, and they're just kind of a facing that goes over your tooth. So what we can do is we can wrap that around the tooth just a little bit and do like a 3/4 crown or a full crown that's just like a hat over the tooth, and that keeps it from ever popping off. Because if you're ever going to have dental problems or anything like that, that's typically, you know, 5 o'clock on a Friday before a holiday weekend. So we try to avoid that as much as possible.
That's right. I guess you get a tooth problem when you're out of town.
Yes.
And that's the hassle with it. So the veneering process. If a patient's there, help me understand, like, how do you let them know what their teeth are going to look like when it's all done?
So the first thing that we do is we figure out what it is that they want.
Okay.
Beauty is in the eye of the beholder, and so we want to figure out exactly what it is that they want to see. We do have a intraoral scanner, and what it does is we scan their teeth. It takes just a couple of minutes, and then all that information goes in the computer and then pops up on the screen with exactly what their teeth are going to look like once they're straight, white, without gaps, without holes, whatever it might be that was bothering them. And patients kind of look at it and they almost can't believe, this is what you can do. I've had patients ask, you can make me look like that? And how? How do we start this? And so that's kind of the first step. It's like a selfie of a before and a selfie of an after, and within 5 minutes we can show you that.
And are they usually very surprised?
Very pleasantly surprised.
Do they ever say, I want that?
Of course. And then we go through how we can get them from point A to point B.
Yeah, so take me through that process, like a veneer process or that. So what's next? Okay, so they pick their smile. Maybe you show them examples of other people with similar smiles. Then what?
Then we can kind of go through, a couple of different treatment options. There's usually more than one way to do things. So once we determine what we're going to do, we can start the smile design process. Women have more feminine features. Their curves are a little bit softer. Men have more masculine features, a little bit more bolder angles and things like that. We want the teeth to follow the lip line, and we follow what we call golden proportions, which is just what is most aesthetically pleasing to the eye. And so, your two front teeth are going to be a little bit longer and a little bit wider than the teeth next door. And so we just kind of go through all of this, and we work with our ceramist, and they create this real lifelike translucency. We don't want these bright, blocky, white chiclets. We want something that looks realistic and looks like it's age and patient appropriate.
Okay.
So whatever that might be, but we don't, the best dentistry, the best cosmetic dentistry doesn't look like you've had cosmetic dentistry done. It looks like these are your natural teeth.
So when I see big bulky veneers walking down the street, I feel like I could spot veneers from 20 yards away. Is that something you think the patient wanted, or you think that was in the dentist maybe didn't have an artistic eye? What's your take?
Unfortunately, it's probably in the hands of the dentist. Patients, they don't realize how much artistry goes behind smile design. It's about 80%. We all know the science behind it. That's what they teach you in dental school is, how to make a crown, how to make a veneer. But the artistry is something that's learned just through experience and really studying how patients want their smiles to look natural. Now,
do you believe that veneers are inevitable? Like, not everybody wants to look their best their whole life, but some people want to look their best in the 70s and 80s. And I guess teeth age too. So What's your take on that?
You take care of your skin, your nails, your hair. Your teeth are something that you need to pay attention to as well. We're living a lot longer, and so some of these teeth, you start getting your permanent teeth when you're about 6 years old. So by the time you're 70, they're going to be chipped, stained, worn. So veneers are pretty inevitable if you want to keep up your appearances.
Looking good. Mm-hmm. Now, people finance a lot of these procedures. Is that true?
Absolutely. We don't expect you finance a car. Anything that's a big investment, you want to make sure that there are different affordable payment options. It's easier and more affordable than you think.
So are the patients for cosmetic dentistry getting older and older, or younger and younger?
We see a little bit of both, but we see a lot of older and older patients getting cosmetic dentistry because we're living longer.
Like what age?
I think the oldest patient I did some front crowns on just to help freshen up her appearance. She was 86 years old.
86.
I remember when she looked in the mirror for the first time, she was almost in disbelief. She said she looked like she was 70 years old again.
So that's what she told you, that she feels like she looks 70 instead of 86.
And her husband couldn't believe it. She just smiles a little bit bigger. She just needed a little bit of cosmetic dentistry to help with some chipping and staining stuff. She'd taken great care of her teeth. There was nothing she had done wrong. Those teeth had just been in her mouth for a very, very long time. And her husband loved it. She loved it. And it's great seeing them.
Do husband and wives ever come in and do it together? Like one partner does it, then the other one comes back and does it?
A lot of times, one of them will come in and do it, and it's almost like they're the guinea pig, and then they love it so much, and then their spouse comes back in, and she got it, it's my turn.
Is that right? We're short on time, but Invisalign, you're big on Invisalign.
Absolutely. Adult ortho, a lot of times as we get older, your bottom teeth just naturally start to shift. It's nothing that you're doing wrong. You might have had braces in the past, but they become harder to clean, start getting stained, build up, food gets caught in there. If we catch it early, it can be just a couple of months, straighten everything out, and then you don't have to worry about it anymore.
Yeah, you mentioned older patients. So like it seems like when you're 40 plus, your top teeth don't show as much anymore, just those lowers. I know somebody like this, and all I look at is that lower crooked teeth. And this is a person with plenty of money, but I think it's their fear of the dentist. I'm guessing, or maybe they don't realize what it looks like.
Well, and they can think that it takes, that it's a lengthy process or that it's really expensive or something like that, but it's affordable and it's fast, easier than you'd ever think.
So ortho is so adult orthodontics. And now what about if they have really crooked teeth? They've never really had straight teeth. Is Invisalign good for that, or you need the brackets?
Invisalign, it's changed so much over the past, it's been around for decades, and back in the day, it couldn't do much, but that plastic is really powerful and it can fix most bad bites. I wish it was around when I was younger, because those big metal brackets are more uncomfortable and they're kind of ugly.
So it's better though for adults, because I've been told by other dentists that Invisalign for kids, 16s, 18, they lose them, they throw them away. If you're not wearing them all the time, it prolongs it. Mm-hmm. So it's better for the adults. Would
Absolutely.
You agree with that? Is that?
And if you have big events, meetings, things like that, weddings, you can just take them out. You don't have to wear them for the night. You don't have to wear them for that day, and nobody has to see, that brace face smile. You don't want to look like you're back in high school again.
And you really can't. Because I'm always told you could hardly see them.
Yeah.
So are they thinner? You just can't really see them.
They're really thin. They're very, very thin, and from a couple feet away, if you stood right up against somebody, you could definitely see that there's a clear layer of plastic on their teeth. But from far away, you can't see anything.
Now you have a team of that, so it's not. They don't always just see you.
Absolutely. So we've got a couple of other dentists in the practice, and they're all very highly trained and skilled, and we're all trained in the exact same way, and we do a lot of continuing education. We make sure that we know exactly what our patients want, and we treat everybody the same.
Okay, good. And you have this concept of where you kind of do everything under one roof. You don't have to send people out to a specialist for this or whatever. Is that right?
Yeah, we try to keep from shuffling you around. Sometimes we do have to send you off for certain things, but we do everything from taking teeth out to braces to root canals.
You do wisdom teeth?
Yes, we do.
Now, are you less expensive than the oral surgeons? I'll put you on the spot.
Yes.
Is that right?
It definitely makes it more affordable keeping it in-house.
We are completely out of time. Final message. Somebody watch this, they hate their smile, or they don't like their smile. But for whatever reason, they can't get themselves maybe the courage to go in and do something about it. So what do you say to that person? They don't like their smile, but for some reason they just can't get themselves to do this.
I just invite them to come in, see us, meet the team, and let us tell you what we can do for you. You'd be surprised how easy, affordable, and quick your treatment could be.
All right. I want to thank you Dr. Davis, I want to thank you for coming on the program. Good stuff.
Thank
Great
you.
Stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.